Okay, I guess we are ready to get started. Thank you for waiting those extra few minutes. We are streaming this on 2 different platforms, so we had to be thoughtful about starting exactly on time. Welcome. This is our first Community Advisory Council meeting in 3 years, if you can believe such a thing. It's kind of hard to believe how the time has gone in the last 2 years, but we are really happy to be back and really happy to welcome you all to this event. Welcome to our guests and our stakeholders and our public. We're grateful for your involvement in the great work that we do and the organization. And I, of course, want to thank our panel, which you'll be getting a bit more of an introduction to in a few minutes. And of course, our embedded workers that are sitting over here at the other table that work alongside of our police partners every day. So very excited to welcome everyone. I am very excited about this discussion today, and I'm not just excited about it because it is a wonderful partnership that has become so valuable in our community, or because it has such a great impact on individuals in crisis and in need in our communities, but because it's a commitment to solutions. It's a commitment to saying, what else can we do? What more can we do to come together and find ways to make wellness a very important part of the way that we see our communities. We believe in wellness and equity at People Incorporated, and in our community, and we believe that our communities have a lot of opportunity to create more and better artifact in our communities that actually drive that wellness. We also believe in creating solutions in our communities. To get those solutions and stand them up, it requires more than just People Incorporated. It requires community involvement. It requires partnership. It requires us to come together and be really creative and really courageous and find things that actually move us forward as a community. I want you to know how happy I am that all of you are interested in this work. I think you're going to have a very exciting and robust discussion with our panelists today. And I want you to know from a People Incorporated standpoint that we will keep working on this paradigm around wellness and equity in our communities until we no longer need to do that. That is our promise. Welcome.
Good morning, everyone. I'm Veronica Nix, Vice President of Community Engagement with People Incorporated. I want to thank Jill, our CEO of People Incorporated, for that warm introduction and also getting us started. So just to let you all know, we have a room full of folks here. We are live on LinkedIn as well as Facebook. So we have folks already on those pages, those channels following us. So what I'm going to do, we're going to introduce our panelists that we have right here from St. Paul, from Boone and Coon Rapids Police Department, and then also our embedded social workers, just so you guys can be familiar with who we have that will be responding and answering questions from either the audience online, as well as questions that we already have for them. So first, I would like to start with Sergeant Justin Tiffany. He's with the Coast Unit with St. Paul Police Department, and COAST stands for Community Outreach and Stabilization Unit. He's been with St. Paul Police Department since 2009. He recently got promoted to sergeant in 2021. Welcome, Sergeant Justin Tiffany. We also have Captain Joseph Gearhart, who's with Blaine Police Department. He's been with Blaine since 2006, and he also recently just got promoted to captain in January of 2022 of this year. So welcome, Captain Joseph. And then we have Sergeant Tanya Harmony with Coon Rapids Police Department. She's been with them since 2001. She's the first female sergeant in Coon Rapids Police Department. So can we give a round of applause and welcome? We also have on the side of them who works directly at People Incorporated, our embedded social workers. We have Amanda, we have Melissa, can you raise your hand, Amanda, Melissa, and we have Amber, who works right alongside of either these officers or other officers within those police departments, responding to those non-emergency calls or calls that involve someone that's having some type of mental illness. So thank you, ladies, also for being here. We really appreciate what the work you're doing. All right, we're already up to about 20, over 20 viewers on online, so we're getting this thing started. So I will go ahead and pose the first question and would like to ask each of you to respond. So I'll start first with you, Sergeant Tanya Harmony. The first question is, how do you believe that having the police embedded social worker has changed the work you do with community members experiencing mental health concerns? Oh, and I'm gonna get the microphone.
Yeah, we wanted to work. Start there. Veronica, just
All right. Yeah.
Here you go, Sergeant. I'm a loud talker, so I'm not always what this position has done for us in Coon Rapids is it's really given us an opportunity to get our community members and potential consumers a face-to-face meeting, face-to-face time with someone who has a lot more training and experience in mental health and dealing with that than our officers do. We have a lot of training in that. It's just different. And Amanda's been able to provide that face-to-face interaction. At that time, she is able to assess those people. She talks about medications, and it's a time to educate. It's a time to get them in touch with resources, which if anyone's ever tried to manage the phone tree at any time through some community or some county mental health, that it tends to get bogged down. You get lost in there a little bit. So this is more immediate access to resources, education for the consumer themselves, as well as potential family members. We have a fair amount of adult children living with parents who are struggling with, how do I deal with my adult child? I don't want to enable them, but I don't want them to go to jail. I don't want them to be stuck in a hospital, those kinds of things. So it allows them some education of that. And then just to possibly do some evaluations. I know we've had a fair amount of situations where people didn't have to go to the hospital because Amanda was able to handle whatever needed to get done right then and there. So keeping people in their homes where they're comfortable, and being able to access those services from there as opposed to going to the hospital or, possibly where they had a bad experience previously. And she has access to services. I know that she's been able to, get people placing in, the homeless placements that she's been able to do, the access to getting somebody into a rehab center sooner than they would have had to been able to do that. There's been a couple of instances also where people were so insistent that they didn't want to do what they were being asked by the police to do, and Amanda was able to get into a position where we didn't have to use force of any kind to get them into the ambulance or to get them out of a situation where they were potentially going to hurt themselves or somebody else. So it's just been a real honor to be part of this program as we've gotten it up and running. And it's really, I think, provided a real access to the immediate need that these people are feeling.
Awesome. Thank you so much, Sergeant Harmony, for that response. I'll go ahead and repeat the question for you, Sergeant Tiffany. The question is, how do you believe having a police embedded social worker has changed the work you do with community members experiencing mental health concerns?
So I'm not a loud talker, so I'm going to hold this a little bit closer. Really, too close. Really, I believe that this changes the perspective around law enforcement. When when we look at what is going on in our community and being reflective of the needs in the community, I think that embedding these social workers has changed the perspective exponentially from a punitive entity to a community-based resource. I think that's reflected in a lot of the conversations that we have with folks that we followed up with after the fact. We've had a lot of good conversations. People have said things such as, I was in a really serious situation, but being able to interact with an embedded social worker or one of the sworn officers really calmed me down. They explained things in a way that I could understand, and it really helped me level off. We also had folks say, interacting with these folks so quick after the initial crisis allowed me time to integrate into treatment or rehab. And one of those folks said, you know, my parents been sober for 8 months now thanks to this. And so those are really impactful statements for us. I also see that reflected in our community partnerships. And so we have a lot of community partners through outreach, county that we work with on a daily basis. And unfortunately, some of those relationships weren't always the best, but because of these relationships that we've built over the last 4 years, we have folks that have come to us and said, you know, 10 years ago, I didn't want to work with the police department. It seemed like we had different objectives. Well, now we're having weekly meetings. We're having follow-up conversations about certain people and the resources that we can access for those folks. It's created a narrative where we're able to communicate across different sectors and really lead to better outcomes for each of these individuals. And so in St. Paul, I think it's really added credence to the philosophy that we're a community-based resource.
Awesome. Thank you so much, Sergeant Tiffany, for that response. And Captain Gerhardt, the question is, how do you believe having a police embedded social worker has changed the work you do with community members experiencing mental health concerns?
Turn it away from her mic. There you go.
Oh, perfect.
Yeah.
I gotta get close to you. I wanted to say ditto, because both of those are very good answers and what I would probably say too. But I just want to add just one little component to it, which is from being that officer on the street, the last thing that we've wanted to do in these types of situations is have to use force on people. And when you have somebody that comes up in a uniform like this, and maybe 2 or 3 of us on a crisis situation, you're already going to elevate that even more. So by having somebody like Amanda in our agency, being able to be that point contact rather than us, and we can go to her and say, you know, you can talk to this person rather than us trying to talk at this person, because that's how we're trained. So I would just add that just the fact that we don't have to be that point person all the time, showing up in uniforms with a gun and having to almost have that authoritarian feel to it. That's what we want to avoid at all costs. And even when I started in law enforcement, this was the last thing that I thought was going to be a major issue that law enforcement deals with in 2003. But it has developed into that, obviously, over the last couple of decades. And these types of partnerships really has helped a lot in bridging that gap, so we don't have to use that force that we did in the past. And that ultimately helps everybody.
Thank you, Captain Gerhardt, for that response. Really appreciate that. And I just want to share a little bit of data from the partnerships that we've had with all 3 police departments. So for 2021, with St. Paul Police Department, we've served 711 individuals. That means 711 individuals that our staff have wrote along or followed up to provide resources and or help to those individuals. For Blaine and Coon Rapids, 167 individuals, and that's for May through December of 2021. And we had just started the partnership with Blaine and Coon Rapids. And then so far for this year, from January to June, we've been able to serve 601 individuals with St. Paul Police Department, and with Blaine and Coon Rapids, 142 individuals. So just imagine if we did not have this partnership, what could have happened or what would have happened to those individuals, not being able to receive that immediate help and support from our embedded staff that's there. Okay, so I'll move on to the second question we have, and you guys can let me know if I need to repeat this one. It's much shorter. I'll start on this end with you, Captain Gerhardt. What do you hope this model will do for your police department?
I think this model's already worked so well for our police department since we've had it for about 1.5 years now. Having Amanda get out there and actually do follow-ups with people, get them into some programs that they may need, or get them the outreach that they need, we wouldn't be doing that. We would literally be going to the call, dealing with it, putting a Band-Aid on it, whether it's sending them in an ambulance to the hospital where they just get immediately released, or released after a few hours, and then the problem just repeats itself over and over again. Now we have follow-up that Amanda can do, and then get that outreach that they really need, so that we don't have to go up to calls at that location anymore. I think that's been the biggest benefit of this, on top of the fact that she also rides with us at times and can actually handle some of these problems on the onset, and also come up with a plan on what's going to happen in the future. I always like to bring up this example, and the reason I think this is important for people to recognize is that, because I was a patrol sergeant at the time, but as an example, we had a call where somebody left their house with a rifle. They called saying that they were suicidal. Now, for law enforcement, what are we worried about? We're worried about, obviously, somebody with a rifle, now they're out in public. And how are we going to address that? We can't exactly make a traffic stop on this car and induce this situation when maybe they're going to do a suicide by cop or something like that. So that's something that we're going to look at and go, we don't want that to happen. But in this instance, I was able to talk to Amanda, get that person on the phone, get her in contact with that person, so we were able to talk, she was able to talk with them, able to meet with them, and actually get them the care that they needed. And we had very little involvement in that. And they didn't even have to go to the hospital in an ambulance or anything like that. I use that example because it's so important, because you look at the outcome of how badly that could have gone versus what actually ended up happening. And you really can't put a price on that. Even that one instance, you can't put a price on. So that's really how big, if you're looking at it like and at that type of a scale, that's how important it is, and that's how much it's changed our agency in dealing with these types of calls.
I would just reiterate, some of the big talking points that the captain had mentioned, that the entire premise behind all these programs is deflecting these folks or diverting them away from a law enforcement response and towards some of those community-based resources. So Veronica stole my thunder and gave you some stats already, but I will give you some further stats in that since Amber was embedded with us in roughly 2018, she has done over or approximately 1,000 diagnostic assessments. So you think the number of hours that would go into that, and that's not just the assessment, she is also doing all the case coordination and the referrals. And so that in and of itself is a tremendous lift. We've had the fortunate opportunity to bring Melissa on board since 2021. And in that time, she's done 158 Rule 25s. And so again, doing all the referrals and case coordination, we're talking about countless of hours, and they are so dedicated. They spend so much of their time both on work and off work, making sure that people are connected with the appropriate treatment options. We've certainly seen, can you still hear me, or are you deaf? We've certainly seen the positive outcomes from that in the community, because we had one individual who was having hundreds of interactions with us over a several-year period. And I'm very happy to say that in the last 9 months, we haven't had one. And so you think about that, it's very hard for us to prove a negative where we look at those 1,000 that Amber has had interactions with, or the 150, and it's very difficult to prove a negative when you look at the overall statistics. But when you look at a case-by-case situation, as similar to the one that the captain here gave, you're seeing very positive outcomes. So I think this is a testament to how profound the impacts that these types of programs can have in our community and for individuals specifically.
Awesome. Thank you for the correction too, Sergeant Tiffany.
Would you like to? What I hope this position has done, and will continue to do. Ultimately, I think based on the statistics and the things that we've been talking about here today, we currently have a partnership with Blaine Police Department, and Amanda really does 2 full-time jobs in her time with each of us. So ultimately, what I hope this does for us is put us in a really good position to have a full-time person, because the need is there. It's obvious to our officers, it's obvious to our administrators and our city council. So hopefully that's where it leads to. This also, it gives us an alternative, our officers an alternative. We didn't have an alternative before. It was either, you run through these questions and yes, no, 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 yes, yes, yes. That depended, that's what we did. They need to go to the hospital, no, we can't leave them here. So it's one of those things. So we have an alternative now. We have a different way of looking at it. And it's not just about when Amanda's there. She's trained our officers that she's been with. They've seen what she can do out there. And our officers can take from that and start to do some of these things when she's not available. She, I guess, goes on vacation too. So it's nice to be able to have her be able to educate our officers in that way too, and have them take from it something, learn from her. I don't have an as extreme example as Joe does, but I do remember one of the very first times that she was partnered with an officer on the street, and they went to a call, and this lady was clearly in desperate need of help. And with what Amanda did, the officers talked about for weeks. Oh my God, did you hear what she did? And I'm like, yeah, I've heard 6 times. Thanks. But just she talked to her, she was suicidal. I think she had a plan. I don't remember if you know this one. The officers get there and they're like, okay, well, Amanda's here. And she talked her through it. She got her into, I don't know if you helped her with her medications exactly, but got her somewhere, called an Uber, got her transported where she needed to be. And the officers were just blown away at how this was handled, because that's our alternative was, okay, because she this or that, okay, she's going to the hospital. And like Joe said, and then she's assessed and she's out in an hour or 2, and now she's no better off. And that's nobody's fault. I'm not pointing fingers anywhere, but so those are all the things that it's done, and hopefully will continue to do, and also be a model for other places. Not everybody has this in their departments, and everybody should have this in their departments, 100%.
Wow. Thank you. Well said, Sergeant Harmony. I really appreciate that. And I think I'm gonna go back to a quote that our CEO Jill said at the beginning. Because of our commitment, your commitment, and we want to make sure that we make the community make a commitment to solutions. So the solution is to get this model out into more departments, to get more embedded mental health professionals working directly alongside of the police. So that's what this is all about, us being a part of the solution. So thank you. All right, I do have a question from the audience that was given. The question is law enforcement or courts addressing how mentally ill violators are being handled? It's a 2-part question, so I'll start with that one. Is law enforcement or courts addressing how mentally ill violators are being handled? And any one of the officers can take that.
You want to go? You're close. I'm going to try not to blow anybody away again. And so anytime that there is a concern about somebody's mental health during the court process, specifically around their ability to comprehend the process, the courts will order what is referred to as a Rule 20 or a mental health evaluation. That is also something that sometimes we advocate for because of our concerns for the person's mental health status. And what that can do is, if the person is found incompetent, they can be referred or petitioned for civil commitment. Now, we've seen this as an opportunity to get people connected, but there's also other things that are available through the criminal justice system in Ramsey County where we operate out of. Some of those are drug court, mental health court, where they are diverted away from a criminal justice system and into kind of a case management style under the court system, where they have access to a case manager, they have access to medication. It's ongoing throughout the time. It depends based on the individual, how long those services will last. And then if they're successful in completing that process, usually it's not a punitive process.
I'll just add that law enforcement, what we have done for mental health and how we handle it is generally, we are not charging people. If we have to struggle with them, things like that, we're generally not, if they're in a crisis, we're not charging them. So it really, a lot of times doesn't even get to the court system because we understand that in a lot of cases, they don't have the capacity to even realize what they're doing. So a lot of times, we may get injured in the process, and if it was somebody that we were actually arresting, we would charge them with, assault or something like that. We generally don't do that in these types of situations, and we haven't for a long time. We just understand that. We try not to create any type of harm to more than the minimal amount of harm, and get them the help that they need. And that's kind of how we have always done it.
Thank you for that response. And I actually am going to have Jeff to come get the microphone. The question came from a gentleman in the blue shirt, and he would like to share a story based off of you all's response to the question that he provided. So we want to thank him also for willing to share and asking questions.
You want to hold it? How's that? First question. Amber, are you single? Yeah.
Amanda.
All that praise?
Amanda.
Oh, Amanda, sorry. She's at least get the name right.
Yeah.
It's one of the certain example of the last 13 years of my life. I was a husband, father, business owner in Duluth for over 20 years. I had a colon surgery in 2008, and I picked up sepsis from the hospital, which traveled to my brain. So in the last 13 years, the first 10 years, I lost my wife, my kids, my $500,000 house, my 5 companies. I never had a criminal record prior to this, none. Now I have 5 DWIs, I'm not proud of that at all, and 2 assaults. 10 years after the surgery, I was diagnosed bipolar, and during that time I had gone through 9 days of inpatient chemical treatment, and I didn't drink, obviously. Still hanging on to you guys. Then recently I completed 90 days at Steiner Kelting, which is one of People Incorporated's mental health treatment centers. Thank you very much, Incorporated. Now I'm in an adult foster care, and I'll be let on my own here shortly. My worst problem is remembering things. I forget to take my medication and so on. So now, I'm divorced, widowed, my second actually passed cancer at 53. Talking to one of my 3 kids, and they're older, just getting going again, and it's great, but this criminal record's killing me, I'm on probation, obviously, so I have this great start. And I think once, it took 10 years to diagnose me mentally ill, and I learned a lot at People Incorporated. I wish I would have done this backwards. I wish I would have did 90 days of mental health and then chemical treatment and so on. I would have corrected this problem 13 years ago. First 2 years I had to learn how to walk, talk, and swallow. And then I was physically looked fine. You can't see mental health. So I went back to work, did my own companies, and I ran them in the ground. And I picked up drinking to kill the pain or to medicate myself. Now I'm on with 90 days at People Incorporated. I did got my medication management under control. You would know this. Big important step. And now I'm going to bring back to the judge in Malagas when I want to break it. This has been somewhat sympathetic towards this last offense. It's ridiculous of paying $500 a month for this bracelet and I'm on probation, and they won't let me go and look for a job. I just don't understand the justice part of that. So that was it's just my complaint, I guess, is it's very difficult to work with the justice system. They want to pay these things, serve your time and do your thing, and that's all fine. But I need to work to do that. I'm retired, obviously, on disability. but I can't afford an extra $500 a month and pay for rent at an adult hospital care. It's not cheap. So, and thank you guys for your service. Thank you, people appropriate.
Thank you for sharing. Jeff, I'll take it from you. Thank you so much. And we'll go ahead and move to our section of asking our Q&A. We do have a question over here in the corner, Jeff, from Rochelle. We're going to take this question, and then anyone else that have questions after Rochelle, then you can raise your hand and I'll send Jeff over to your area.
I was hoping that is not. If you could provide some guidance about how to work with other precincts in the metro in terms of being able to partner with them to improve the response to behavioral health emergencies that don't create further trauma. And so coming from more of a perspective of the short-term residential where behavioral emergencies might be happening on a regular basis, oftentimes needs for transport holds, and how can we partner to make that work more smoothly and reduce some of the apprehension that officers have to working with these programs. I know that a lot of turnover has been a barrier, but what are your suggestions?
I mean, I can kind of answer some of that from law enforcement side, but I'd actually like to hear from the therapist here too. You know, part of it is sometimes the counties, like in Anoka County, we also have a crisis unit that gets utilized in some things and it's county-wide. But a lot of the problem, part of the problem is every agency is like its own little island. And it is something where their policies and procedures could be completely different from one city to the other and how they want to handle things. And you start looking at the specific trainings that law enforcement has to do in this state when it comes to these like mental health. So we have a good umbrella to start from, but it's the procedural aspect that's always the difficult part in getting people to really start looking at that. So what it comes down to and what we've done is we start talking to other agencies because we know we have an embedded person in our agency and they want to know what we are doing in these types of incidents and what's working for us. So we do have that line of communication from agency to agency that works, and we're getting more and more agencies that are actually reaching out and trying to bridge that gap right now. So they can look at doing something very similar, or they can start educating their officers on it too.
So, thank you for that response. And
Now I'm just kind of afraid of this. So what I would say is start that dialogue with whatever respective law enforcement agency it is before the crisis. It's so valuable to start having those conversations and understanding both sides of the perspective. One of the things that we're doing in St. Paul is in the next month, we are having a training with both law enforcement and one of the IRTs that's in St. Paul to kind of run through some simulations and scenarios where it's like, this is what the possible outcome is going to look like when we have law enforcement respond. And I think that's a good way of moving through the process to see what's reasonable for both sides. And then having those conversations beforehand and saying, if you are going to call law enforcement, these are the possible outcomes. And these are the things that are happening on the clinical side before law enforcement is called. And so being able to do that, I think, adds a lot of, builds relationships, but also adds a lot of understanding on both sides.
I just want to clarify for the room as well as our folks that are online. Sergeant Tiffany used the word IRT, so it's an acronym for Intensive Residential Treatment Services, everyone. And that's a facility that someone can go into and serve up to 30 to 90 days to receive resources and services.
I don't have a solution, but just to give you some perspective, like Joe said, each department has their own policies, procedures for taking care of things and handling some of these things. And some of the challenges that come with that is that not every department has a dedicated person that deals only with mental health or community outreach in that respect. And so I think that's a challenge due to some restructuring in our department. We used to have somebody that was dedicated to that, and now that position is no longer something that we're supporting at this point. So there is some challenges with that, because then you get different officers all the time, and they don't maybe have that necessarily that relationship or that connection with that particular home or those people. So that's something too that we need to think about, how, not just your question, how are we going to make that happen, but how within our department are we going to be able to dedicate somebody specifically to that type of outreach.
I think what has been said is all great things to abide by. I guess it's been my experience, and the thing I'd like to add is, I think relationships are huge, and like you had said, sometimes there's not that one dedicated person, but if there's an overall understanding, again, trying to find that understanding prior to the crisis, so everyone's on the same page. What I found is sometimes it's unclear what the responsibilities of both parties are, right? And I think that working together is the best way to work together, and that's the approach I take. If we're all a part of this call, we're all part of the solution. So working together versus kind of two entities is probably the best approach. I don't know if anyone else has to add anything on here. All right.
Yeah. Jeff, you can hold the microphone. I was given a question. So the first question is, my mental health diagnosis has been weaponized against me by my abusive husband. I'm flagged as an EDP, when I've asked you to tell me what EDP is, in several department systems. This allows his abuse to follow me. I've told friends and family to never call police if I'm in crisis. I fear being shot or put into 72-hour hold. Police don't flag health status in other situations. Example, heart disease. I feel like I cannot call police in an emergency, ever. Once they see EDP, will they believe me? Will they take me seriously? The question is, getting to it is, can I do anything to remove this EDP label? Am I just stuck with it as an enduring effect of domestic violence? So I don't know if that want to go to our mental health professionals. Is there anything that can be done? Or
I think that's more of a systems question.
Systems question, okay.
For clarification, EDP is a label that's utilized sometimes for an emotionally disturbed person. That's what EDP stands for.
Thank you.
So, we need the microphone?
Jeff, can we get the microphone?
You can answer.
Can this person do anything to remove this EDP label?
Well, there's no real label in law enforcement other than internal records systems. So we don't, and I can speak of probably Anoka County only. But in Anoka County, we have a record system that we can look up, obviously, reports in the past from an agency, and I believe probably every county or city has something similar. Really, it comes down to training. I was in charge of our new officer training for several years. I was the coordinator of all our field training program. And really what it comes down to is getting officers to realize just because you had a call there before doesn't mean that's what you're going to get this time. It's really trying to have a clean slate for that officer so that they don't go in with preconceived notions of this is what I'm dealing with, and you handle it like you've never been there before. Something that I've always felt is important, because otherwise you always have that thing in the back of your head saying, this is what I dealt with before, I'm just going to basically make a biased decision here going, this is what I'm going to do now. I don't want that in my agency, because this is the type of care that you're going to end up getting. You're going to automatically assume this is an EDP type situation where it may not be that type of a situation. So part of it for law enforcement is training. And I think that Blaine has done a good job of doing that and not having that preconceived notion before you get there, and start treating that person like it's a mental health problem, because it may not be that way. And unfortunately, this story is like many stories that I've heard over the years of very similar type of situations. I hope they are dealing with this in Blaine, because I don't want our officers trained that way and just automatically assuming that. And it's too bad that that is what's happening, because unfortunately it's something that is constantly happening with a number of people.
Thank you for that response.
So we can't speak or, I can't articulate what's going on in other organizations. What we do in the St. Paul Police Department is we start with believing. And so we understand that the folks in the mental health or chemical health systems might be some of the most vulnerable people that we're interacting with. And so we have to start with believing so that we can get to the crux of what exactly is occurring with those individuals. And so that has historically been our mantra over the last 10 years. And so ideally, I would hope that this individual isn't something that, or they're not experiencing this in St. Paul.
All right, thank you.
So.
We'll show our hands. Are there any questions from the audience here? Okay.
So I guess my first question is to back up on the question that just came in, and I'm wondering if anybody can give a resource for that individual who was courageous enough to ask their question, of somebody they can connect with that could maybe help them navigate, whether it's your department or not. I don't know if any of you would be willing to put a number out there for the individual to ask the question to be able to contact so that they can get some help navigating the situation so that it doesn't continue for them. That wasn't what my question was, but it was just something that was triggered for me.
And what I'll do, I'll follow up with them and with the person that gave me the question.
Okay. Thank you.
You're welcome.
So I'm gonna own that I do most of my work in Hennepin County. I'm a children's mental health case manager with People Incorporated. I've been with People Incorporated for 12 years. And thankfully, in more recent years, I have seen more shifts in willingness to work with us as outside entities, because we're not all embedded. And I guess I'm wondering, if you're seeing more of a willingness within your staff to work with outside entities, because that's been a crucial piece of success for us in the field, in accessing services for our kids, keeping them out of the juvenile justice system, keeping them out of the adult justice system, because we have kids that are transition age as well. And a lot of times we hold the relationship, and we are the ones that the families are calling, whether we're the appropriate entity to be calling or not, because a lot of our families are afraid to call the police because of past experiences, past traumas, and just kind of wondering how I'm happy that we have embedded social workers, but also it's one person, and wondering kind of how you're navigating that with the rest of your staff as far as like other outside entities, because we too hold the information and the relationships and can be very, very useful and helpful in de-escalated situations if we're given the opportunity. But historically speaking, what I have found is that I show up on site and I'm put in a corner and told to be quiet because they're handling it. And handling it often has involved a lot of trauma from the kids that I'm still cleaning up. Because I have some kids I've had for 12 years and we're still talking about the police. And what happened to them with the police. I've had 8-year-olds in handcuffs in schools. And it's horrifying what has happened to some of my kids. And just kind of wondering what you're doing within the department also to ensure that there is appropriate education about the fact that there are people in the community that are useful resources for you guys as well. And we would like to be utilized in those spaces.
I'm gonna let Jeff keep that microphone, and I have one for this table, so whoever wants to respond.
My exercise for today.
Yeah, you stay out there.
I'm leery because I don't know how power. Is it on? Can you hear me? Okay. So what we're doing in the St. Paul Police Department is everybody that goes through our academy at some point or another is trained through crisis intervention training. It's the 40-hour training. We're also bringing in folks that do training during our in-service. And so it's also a post mandate on top of everything else. So our department gets quite a bit of training with all the various entities. We actually just had Ramsey County Crisis come in to discuss some of the things that they can do for our organization and the resources that are available. They also work with Ramsey County Children's Crisis, and so that's one of the resources that our folks reach out to quite a bit. There's actually a East Metro Crisis Alliance, which facilitates a webpage where all of our officers can go to look for the resources. And I've actually seen over the last 5 years that there's been almost a seismic shift in our officers reaching out to folks. I'll bring up one situation where there was a gentleman who was on a bridge and he was suicidal. And there was this outpouring of requests for folks to kind of gather information. And ultimately what ended up resolving the issue was Ramsey County Crisis. And so they were able to reach out to Ramsey County Crisis, connect with a case manager who ultimately, within a matter of minutes, where they had been out with this gentleman for an hour and a half, resolved the situation. And so it is a resource that is going to be continue to be used over the next 50 to 60 years and until something better comes along.
In Coon Rapids, can you hear me? I don't need that. In Coon Rapids, we work really closely with our Anoka County teams in terms of our child protection and our adult protection. We also have, there's a facility that is actually in Blaine that works, Alexandra House, that works with domestic related situations that involve women and children in those situations to give them access to what they need, help through the court system, and a place to stay if they need that. And I know that we actually just had a meeting with adult protection about how can we do this better? How can we be more involved with each other? We need to start, and that needs to be the shift in law enforcement. When I started 20 years ago, it was like law enforcement did this and you guys do that, and everybody just kind of does their own thing. And there does need to be a shift in where we're all working together at this point, as opposed to separate entities. We all need to know that at some point we're going to need help from other agencies, other departments within the county. And we need to do what's best for the community member, not just, okay, well, this is my focus. That's not really my job. I shouldn't have to make the extra phone call or this, that, or the other thing. And I think we do a good job in Coon Rapids of making sure that that information is getting to the right people, and understanding when we have these meetings with adult protection and things like that, to know that, yes, there's people here that you can reach out to and we'll meet you anywhere, anytime. So. Sure.
Can I respond? Actually, I think being in a dual role, being embedded, we have information that can't be shared with officers because people's health information is protected. And so things like diagnoses and stuff like that are things that we don't have the liberty to share. So when 911 is called and you get an officer responding to a mental health crisis, even with an 8-year-old, the only information that an officer has in that point in time is whatever was articulated over 911 dispatch. So they're coming to a situation not necessarily having any of that background information. And then there are mental health professionals that are there, but how do you get that information communicated without breaching some sort of HIPAA violation? I think that exposes, another crack in the system, another place where people get stuck and get lost, is because there isn't necessarily open communication that can happen for valid reasons, because someone's mental health diagnosis they feel is being linked to the police, right? So it's a double-edged sword that I think community members need to know, because if you know that that's a gap in the system, you can approach it differently when you know that that's there. So I think if kiddos or anyone in the community is struggling, it's important to articulate that to dispatch when you're calling, to say that this is a kiddo that blah, blah, blah. If you're the school calling, we want you to know that we have a social worker that's really connected with the kid and they feel safe with the kid, so that the officers responding know that they have someone there. Because from my experience, an officer they don't know, they're just there responding to whatever that little bit of information that they got, and they're just doing what they can with the bit of information that they have.
Thank you, Melissa, for that extra information. We really appreciate that. Do we have any other questions? Yeah, good.
This is for our team of social workers. We talk a lot about at People Incorporated how some of the work we do is the best kept secret. That a lot of our community members probably don't know. I would venture to guess that most of Blaine, Coon Rapids, and St. Paul have no idea that you guys are embedded in doing this really important work in the community. So my question to you is, what do you wish the community knew about your role in those communities?
It is a big question. I think I'll talk because I'm already talking. I think it's important to know that we're a small part of a very large and very confusing solution. So we don't wear capes. We can't fix every situation. We don't have all the answers. We're not skilled in every scenario, but we're doing the best we can with the information that we have, and are there because we want to be part of the solution. And I think that that's the biggest thing. There's a lot of misnomers about what we can and cannot do. And so it's helpful to know those things.
Yeah, and I'd like to add on that what I really hope people take away from this is the community can also be a part of the solution. You know, like Melissa said, we are a tiny piece of the solution, but the broader solution is also the engagement with the community and kind of realizing that they have power too to help. So.
Thank you, and thank you for that question. I do have a question from online. Question is, are there different procedures in place throughout the Twin Cities regarding whether the individual is an adult with mental issues or if it's a child with mental issues? So are there different procedures in place throughout the Twin Cities regarding whether the individual is an adult with mental issues or if it's a child with mental issues when you're responding?
Yes.
Can you elaborate a little bit more?
So, because of the way that things are available for the different entities, unfortunately, juvenile resources seem to be fleeting, and so we don't have as much access, and like even the hospitals that can service some of the juveniles that we're interacting with are kind of few and far between, where, you know, fortunately we have more access to certain systems with some of the folks that are adults, whether it's either through the mental health system, whether it's embedding some of the services from our embedded social workers, the courts, all of that stuff. And so it's certainly a challenge, and there's definitely a disparity that we would like to see some parity between the two, which, you know, I think that's obviously very logical that, you know, this should start in the juvenile system and they should have the utmost access to these resources so that we can mitigate the progression to maybe a more serious mental illness or chemical addiction.
I'd
Don't
say,
say yes, Captain Gilmore.
I just piggyback, it's the exact same thing. I agree with that. And just to add a little bit more with juveniles, as far as our procedures are concerned, there's just a lot more questions surrounding it. And with parents, generally with parents, because you're usually there with parents or some relative that has some background they can give you, where adults, you don't always have that. It may just be some random person calling on an adult doing something that doesn't have any idea of what's going on. So the procedures are different just on how we do it, just because we may be able to get more information from family members. And then where have they gone in the past, what works for them, and we can formulate a plan after that. But it is true that there's only a few hospitals that will take juveniles, and especially if they're in crisis. And there's even, it seems like even fewer facilities for long-term care that will take them too. So it's definitely something that we have to work around.
Thank you. We have one last question, and then after this, I'm going to call our CEO, Jill, back up to close us out. So before I do the last question, I do want to mention one of our key partners in the state of Minnesota is NAMI, National Association on Mental Illness. Definitely is a key resource that people can call. And what they recommend is if you're in need, make sure when you're calling, when you call the police, you ask for a CIT trained officer or a mobile crisis unit. And CIT stands for Crisis Intervention Team. So when you're calling the police and you're dealing with someone, a relative or friend that's going through a mental illness, be sure that you let them know that you would like a CIT trained officer and or a mobile crisis unit. That will get you kind of in the right direction to some mental resources. The last question we'll take for today is, in training, police officers often complain we are not social workers, quote, end quote. Are they a kind of social worker? That's verbatim.
Yeah, I'll take that question. If it does come up, I always like to say something like, well, you are now. You know, like this is our job. It is. I've said for years now that even when I got into law enforcement, it was more dealing with the criminal aspect of things, and our job has morphed into more of a social worker aspect of it. And we have to understand that. And honestly, if law enforcement officers can't get behind that, then it's maybe time to seek a different profession, because that is what it's changed. We have to roll with those changes. And I've been doing this for almost 20 years now, and I've had to roll with a lot of changes. And there's officers that have been officers for 30 years are perfectly fine doing this more of a social work aspect in some situations, but also doing some of that law enforcement aspect, and they can adapt to it. We need officers that can adapt to the changes that are coming in law enforcement. And it has been. This is what it is. And to be quite honest, like this mental health aspect of this profession is actually, I think, a good thing in the sense of, for me, in dealing with this now when it's really kind of developed into what it's developed into, because it's more of a passion for me too. So it's good for me that I'm in this position, because I'm passionate about this. So that's generally what I tell officers who want to complain about that, and I stand by that. And that's why we want good officers in our agency that are going to understand that those changes are going to continue to happen, and they're going to adapt, and we're not going to go back to the old way of doing things just because they don't like something. But luckily in our agency, they understand that when they start here, and they understand that that's part of the job.
Thank you, Captain.
And if I could just add one thing completely off topic. Since we're coming to a close here, I just want to say that if you haven't already realized it yet, People Incorporated has done a very good job with the embedded mental health professionals that they've chosen to work with law enforcement, because if you haven't already noticed that they're very driven, and they've worked very well with our agencies, and it's hard to find really good people to be able to bridge this gap. And the fact that you're able to find people that are able to do that and work very well with us and have this program be successful is a testament to your organization and to being able to do that. So I want to get that out before.
I would love anything else.
So just regarding the last question, I just reiterate what Joette said, and I can honestly say in the last 4 or 5 years since I've been doing this, I've only probably been asked or heard that statement maybe a handful of times. And my response is always the same, in that, okay, well, what is your job? I think you signed up to do community-oriented policing. I think you subscribe to the whole problem-oriented policing and proactive policing. And is this not all those things? And it absolutely is. And then usually there's a very long silence, and they are quickly to dismiss. So yeah, I would agree with everything that Joe had to say.
Thank you, Sergeant Tiffany.
I agree as well. Just want to add, when I was training people, I would always tell them, you need to, in this job, in this profession, you need to become experts on things you know nothing about. When I started, I wasn't married, I didn't have kids, I didn't know a lot about social work, and I was counseling parents on child rearing and handling marital problems, or being the mediator between them, and you just have to learn how to. It comes with communicating. You need to be able to communicate. Thankfully, in Coon Rapids, we have a fair amount of people that like to talk. Ooh, do they like? I'm like, it's time. We've wrapped up. They have no more problems. Literally, you've helped them with all of that. So, thankfully, I think we're in a profession now that's moving more towards that communication piece and being able to kind of walk people through things. And, but yeah, I mean, that's some of what we do also, and I think that more so coming. So,
Awesome. Thank you all. Jill, we'll have you back up.
Well, as we finish our work today, I just really want to thank our panelists, and I want to thank our vetted team. Right here in this room, we have 6 solution makers that are out there trying to change the way we view community wellness. And that is a brilliant, brilliant place to be. I love the work that's being done here. I think it is so important that we recognize that we all have mental health. We're just in different places on the continuum. And if we look at it that way and we recognize that everyone deserves an opportunity to have a solution forged for them that actually meets their needs to the best of their ability, acknowledging that we're all human and we do the best we can, to Melissa's point. This is really, really powerful. We are creating wellness, we are creating community solutions, and we are doing a beautiful job of painting a picture in that blurry gray area between 2 very different entities that can come together for all the right reasons. So I just want to say thank you for all of you coming, all of you online that see this as very important. A little bit of a shout out for the Central Access Line at People Incorporated. There was a comment made earlier about resource numbers. That resource line works with thousands and thousands of people a month, trying to help them find the resources they need. It is actually online, but it's 651-774-0011, for those of you in the room who aren't aware of it. I think this is a really great way to take the first half of Wednesday, and I hope everybody goes out and forges more solutions for our communities. Thank you so much to everyone. Appreciate it. Really appreciate it. Such a